We're going to run through a presentation, but we should have a lot of time at the end to take questions and just have a discussion. Right. So thank you all so much for being here. I know it's a busy time of year as you prepare for the next school year. So appreciate you joining. Kind of an overview of how we're going to spend our time together. Going to provide you with some history of the pilot and the learning community. Principal Lamb, some of this will be familiar to you, and also kind of outline our vision for the work going forward. And then want to leave it open so that we can review the proposal process and answer any questions that you all might have. So just going to kick us off by talking about setting the context for the funding and kind of where this bucket of money is coming from. So the initial launch of the Student Mental Health Supports Pilot, that happened in the 2022-23 school year. I just think it's important to note that that initial launch of that pilot was designed within the context of one-time funding. At that time, DEEL received $500,000 in council budget action funding. As we were planning for the rollout of the mental health investments in early 2022, we were directed to hold off on moving the work forward. They were anticipating some possible budget shortfalls in the 2023 budget process, and that delayed implementation. So I want to set that context because those two factors, both the initial one-time funding source, as well as us having a short runway for implementation, because we got the green light to move forward with the funds late in 2022, that led us to select and invite initially 4 current levy schools that we have existing relationships with at DEEL to use the funds for what we were calling the Student Mental Health Supports Pilot. So we selected 2 sets of middle and high schools with a shared feeder pattern. So we had Aki Karosi Middle School and Rainier Beach High School, and Denny Middle School at Chief Sealth High School. And as the initial pilot was just launching, the tragedy happened at Ingram High School, and there was the ensuing outpour of student-led activism and advocacy that was really demanding more funds and advocacy for student mental health supports in schools. That led to an additional $4 million in funding being appropriated to DEEL for 2023 and 2024. Part of that $4 million was specifically appropriated for Ingram, so $250,000. And we wanted to be responsive to what we were hearing from the Ingram community about the critical need for supports from students, families, and staff and faculty as well. So we added Ingram to the existing pilot so that they could receive funding within the 2022-23 school year. So now that we have that additional $4 million in funding, that allows us to renew our funding with the 5 original pilot schools and continue to build on that foundation that they have set, as well as expand and add additional schools, which is why we're all here today. And we'll unpack this a little more, we'll discuss today, but the learnings from the pilot phase and the work that these 5 schools initially did, those have really directly informed the next phase of this investment. And as we move from this pilot phase, we really envision the next phase of this investment being centered around creating a student mental health supports network. We'll talk a little bit about what that means, but we're hoping for increased coordination, and we really want things to be done in partnership with students. So part of what we did with the original 5 schools as well was ask them to partner with DEEL and form a learning community. And that learning community had participation from pilot school staff and leadership, community partners that were doing some of the work at the schools. We had institutional partners from SPS and public health, as well as students. And really the learning community was the main site of stakeholder engagement. So some of the activities that happened, we had 4 monthly convenings that took place March through June. One thing that I just really want to stress was that because of that kind of short runway that I just referenced, schools did not even receive funding until January of 2023. So they essentially had 1 semester to implement services, and they had to do it really quickly. And so the amount that they were able to accomplish in that short time was really phenomenal. And so to also be able to learn from that and kind of see it in action through the learning community was really invaluable as we were thinking about how we wanted to shape the next phase of the investment and how we wanted to use that $4 million. So outside of the learning community convenings, participants also they took follow-up surveys, they participated in some worksheet activities, and we also had the opportunity to do site visits at each school, and that really helped us gain much greater insight into implementation of the support services, helped us identify successes and challenges, and just continue those conversations that were initially seeded in the learning community convenings. For student engagement, we had multiple entry points of student engagement. We had informal listening sessions with students at the 5 pilot schools during our spring site visits. We also had student representation on the learning community, and students from each of the 5 pilot schools formed a student expertise subcommittee. And we also wanted to honor and acknowledge that Seattle Student Union's advocacy played a big role in securing these dollars. So we engaged them as well. We had a series of meetings with their board, but we also wanted to make sure that we were providing opportunities for the students at the pilot schools to provide feedback, but also really contribute as key partners to the work. And then lastly, as I said, Public Health Seattle King County and SPS both participated in the learning community. They were also very key thought partners in helping us identifying and gaining access to the source data that ultimately informed the needs assessment, and also provided guidance on how we should prioritize various scoring and selection factors in that needs assessment analysis, which we will get to in just a bit. So the most important key learning that emerged from all of that stakeholder engagement was identifying a critical gap in service for our Black, Indigenous, and people of color students in receiving culturally specific responsive mental health supports that were effective, that were healing centered. And we also heard from BIPOC students directly that they might be hesitant or face additional barriers in seeking out some of the direct clinical support services at their school. And I think this student quote on this slide really points to some of the root causes to those barriers, because that includes a lack of certified mental health clinicians who share BIPOC students' identities and who also have similar lived experiences. And the student's quote also emphasizes the importance of students having trusted adults, someone they can count on and relate to. And it really helped us understand the need to implement a broad, multifaceted strategy that would deliver supports for students in a variety of ways. And so schools in the initial pilot, we really did want to center school communities and give them a lot of flexibility to do what they thought was right for their school community, as long as there was a connection to supporting student mental health. It was an allowable use of funds. And I think that flexibility really ended up paying off both in what we could learn, but also in the student experience as well. So this multifaceted strategy really includes a broad range of services that schools can offer. And we want to offer student supports that might range from direct clinical care. So that might be either a licensed clinician in a school-based health center, or partnering with a community-based partner who has practitioners of color who can come into the school and offer supports. It might also include mental and emotional health screenings and outside referrals. as well as social emotional learning in schools through dedicated time within the school day. That was a big thing that we heard from students as well. And again, want to point to the student quote from the Rainier Beach Town Hall. I think this captures students' demands for having a multifaceted strategy, as well as underscoring the importance of that strategy being both co-designed and co-implemented with youth, and really creating some intentional and specific opportunities for youth to lead and inform the approaches to the mental health supports that are being designed and implemented at their schools. So we're very grateful to the learning community and the original 5 pilot schools. It's, as I said, in basically half a school year. They accomplished so much and allowed us to learn a lot. And we did apply those learnings in a very tangible way to the future planning of the investment and the network. So through the efforts of the schools and the learning community, we were really able to gain greater insight into both implementation and effectiveness of the current support services. We learned about successes and challenges, and that really shaped and directed the work. So the culturally specific responsive focus that we just discussed, and seeing the ways that all the pilot schools were doing very innovative things with community partners, with students to respond to that CSR gap through this investment, as well as having the opportunity to hear directly from BIPOC students about their experiences accessing those services or not accessing those services, and the impact that school environments had on their mental health. All of that is what led to the development of the recommended interventions for school year 2023-2024 that schools should consider implementing. That list of interventions is in the RFI overview document. I can't remember the page number off the top of my head, but I'll drop it in the chat before the end of the call. But those interventions they lay the foundation for what we're calling a mental health investment framework. And that's really focused on identifying culturally specific responsive strategies for better supporting our BIPOC youth in schools with mental health supports. Another piece of that is the network goals. We set those in partnership with the learning community. That's also part of the emerging investment framework. Those goals came from some common through lines that we found in the work of all the pilot schools. Vic's going to go over those in just a moment. But really much of our key learnings came directly from the students themselves. They really informed and affirmed the CSR focus. They helped us to identify what student mental health needs this investment had to address, as well as the various assets that they are bringing to help us address their needs. So all of these synthesized learnings provided the foundation for the landscape study and the needs assessment framework, which I'll talk about in a moment. And that's the process through which your school was identified as eligible to apply for funding. So in order to identify schools that would be eligible to apply, we went through a landscape analysis and needs assessment process. We drew from 5 data sources to try to measure some student mental health outcomes, as well as risk and protective factors across Seattle Public Schools. So those data sources are listed at the top of the slide. It was the Washington State Healthy Youth Survey, the OSPI report card, SPS administrative data, SPS school climate survey data, as well as Seattle PD crime statistics map. The table that you're looking at on the screen, so it outlines the score categories as well as the indicators and data sources that we use to prioritize schools for expanded mental health funding. So in addition to student mental health outcomes, DEEL included mental health risk and protective factors, as well as a demographic priority. So when we talk about the mental health outcomes score, that's measuring adverse mental health outcomes that this investment is seeking to improve. So you could see the indicators there: suicidal ideation, depression, anxiety. Main source of data there is Healthy Youth Survey. The risk factor score, those are risk factors are lived experiences that might have a negative impact on student mental health. as well as behaviors that can be symptoms of mental health struggles. Whereas protective factor scores are the opposite of that. Those are the lived experiences and environmental factors that can really sustain and improve student mental health. And then the demographic priority score was a school's percentage of BIPOC students and multilingual students who are English language learners. That demographic priority score was particularly important to us for this investment, since the primary focus is providing culturally specific and responsive mental health supports to BIPOC youth. There's a lot more in-depth information about this in a full summary report. I think it's linked in the calendar invite that Vic sent out, but again, we'll drop that link in the chat as well. So the landscape study that we conducted produced some key parameters that we should apply to the needs assessment analysis and some filters and benchmarks. The first was a focus on high schools. Data shows a higher risk among secondary students, and suicidal ideation and attempt rates among youth ages 10 to 24 are highest in the 14 to 17 age range in our region. And so made the decision to focus on high schools. And also, again, because of the CSR focus of this investment, the needs assessment weighted a school's demographic population so that we could prioritize services to the largest possible number of BIPOC students. So we set a demographic score benchmark of 4. We also prioritized larger, comprehensive non-option high schools. And how we got the designation of what an option high school is. We used SPS's definition and the list of option high schools on their website. It's linked in the deck, but again, I can drop that in the chat. And the reason for that, while we recognize that SPS option schools are a really excellent source of targeted supports for specific student populations, and that there is a lot we could learn from what they're doing, that learning might be limited in its applicability to larger comprehensive high schools, and then the ability to implement or replicate the same type of supports in those buildings would be limited. So those were some of the filters and initial benchmarks that we set in the analysis. And then this was the final results. So you can see that there was 7 high schools who met the criteria. The 3 high schools that are highlighted in green are already part of the pilot. And so it was also good to see that their participation was affirmed through the needs assessment process. And then the 4 high schools who will be eligible to apply for funding are Nathan Hale, Garfield, Cleveland, and Franklin. So again, encourage you to review the full report and analysis. And I'm going to hand it over to Vic to discuss the proposal overview and some key information, and then we'll open it up for questions. So I will hand it over to you, Vic.
Okay, great. Can you hear me okay? Okay, awesome. One thing we want to do is we're continuing to just illustrate the shift from the pilot that took place last year to the network that's starting this year. Is just to sort of re-ground ourselves in the goals that are set up and outlined for this investment. So these goals are listed in page 3 of your RFI overview document. And I will, just for sake of clarity, I'll read through these and maybe offer some more comments as well. But the first goal is to leverage the expertise of trusted community-based partners to offer culturally specific and responsive mental health supports across a continuum by providers who share BIPOC students' identities and who have similar lived experiences, inclusive of family engagement centered on culturally specific responsive family supports that are multilingual, asset-based, and welcoming. So obviously you're going to have that to refer to as you go through your proposal development, but I think the key takeaway here is we just really want this funding to be able to allow your school to enhance your capacity to serve students, especially your BIPOC students. And a really great way that we saw that happened in the pilot was by tapping into the expertise of community partners that do reflect your BIPOC students' identities and lived experiences. So we're really excited to emphasize that for a goal of the network. Goal 2, I'm not going to read through the whole thing, so you can reference that in the actual document. But the key thing here is in your RFI application document and in the needs assessment, there is a really strong and articulated sort of like public health approach to thinking about student mental health at your school. So this is talking about you know, thinking in terms of risk factors and indicators and their underlying root causes. And so sort of thinking about what can you do with this funding? What can you do to bring in additional resources? What can you do to enhance existing resources at your school and existing programs to address those root causes and those specific risk factors? But also looking at the other end of the spectrum where you're thinking about how to reinforce or build out protective factors and things that are, maybe preemptively or proactively building students' student mental health as opposed to intervening, providing a more of an intervention or sort of a therapeutic solution to existing concerns. So I think one great phrase that came out of this whole needs assessment process was there's adverse childhood experiences and also positive childhood experiences. And so a very great strategy that we want to support is having both of those happen together. And so that is what goal 2 is getting at. And like I said, and Amelia referenced this as well, there's really good resources in the needs assessment document and in the RFI application that kind of give some really clear examples of how to go through this framework of thinking of risk factors, protective factors, different strategies that map to those factors. Goal 3 is similar to goal 1 in the sense that we want to make sure that we're whatever sort of clinical supports are available at schools, we want to find new innovative ways to make sure that those clinical supports are culturally responsive and accessible to students that come from varied backgrounds and BIPOC backgrounds in particular. So, we want goal 3 is basically similar to that in the sense for goal 1, and we provide some specific examples of like how can you make the clinical supports that are available at your school more culturally specific. So that's talking about your school-based health center. There's clinically trained mental health specialists at your school-based health center. You probably have some school social workers that are clinically trained, but it also refers to external partners who might come into the school to provide clinical supports. And this funding, we want to make sure that any sort of clinical supports that are available to students at your school have that lens and that emphasis on culturally specific and responsive care, whether that's the nature of the care or the identities of the adults who are providing those supports. We can go to the next slide. So again, as we're thinking about the proposals for the upcoming year, we should also be thinking about sort of you're going to have this funding for your school. This is going to be something that's going to be supporting activities at your school, but just similar to the pilot, there is going to be this network of schools. There's going to be the support of other school leaders who are doing similar work at similar schools that came up on the needs assessment. And we really want to make sure that schools are leveraging the expertise of other schools in the network. They're leveraging the expertise of folks that DEEL are convening, research that DEEL has done, also just some experts that are at SPS, at public health. And so that's sort of the background in the network, and strengthening coordination among all these different partners. That's a huge goal of the network. And we're really excited to sort of take that and enhance that for this next few school years. And leveraging participant expertise. We want to make sure that through our network, we are actually enhancing and sort of taking all the learnings that are happening at each school and pooling that, being able to share that out, being able to take some innovations and some learnings that are happening at different schools and actually apply that to changing different strategies that are across different schools. And last bullet, fostering opportunity for community learning to inform systemic approaches to culturally specific student mental health supports throughout the continuum. So again, these are all speaking about ways that we can sort of learn from each other within the network. And we saw how we were able to do that really well with just 5 schools. So we're excited to just increase the number of schools and increase the number of school leaders and community partners that are thinking about these things and make sure that that is something that we can just expand and channel throughout the network and hopefully beyond. Can we go to the next slide? So I'm going to give a little bit more, this slide is talking a little bit more about specific application details. So the first most important item is obviously when the application is due. So it's due Friday, September 15th by 11:59. The funding amount is listed as this range that you see here on the screen. So to sort of give you some context about what that range means, Principal Lamb, you might notice that this basically is twice what the funding amount was available for last year. So that might be useful context to just sort of think about what your plans are. But there's a minimum threshold, so we're expecting proposals must come in at least at $113,843. And they can be no more than $227,687. So those are very specific numbers. And just to give you some background on why the numbers are so specific is that we have sort of round numbers that are available. For example, like they're basically round numbers, but they go through an indirect cost because this funding, when DEEL contracts with Seattle Public Schools, there is an indirect cost that comes off, which leaves us with these somewhat random numbers. So obviously that there's the minimum and the maximum, and we're definitely encouraging schools to think creatively and think about ways that they can maximize all the available funding. But let us know if you have any specific questions around sort of where your proposal is ending relative to this range. We're definitely trying to make this application as low barrier as possible, while at the same time prompting your school leadership team to think really clearly about what available resources are already at the school, what community partnerships can be brought into the planning and to the implementation. And so we do have it's a different application process. It'll look different from again, Principal Lamb, what you looked at last year. There's some similarities. There's similar budget template, but there is like an application that wasn't there last year, which asks sort of prompting questions, both to help DEEL understand what your plans are, but then also to sort of help your school use the application as a planning tool as well. So with that said, recommended page limit is pretty short. It's 2 pages, 12-point font. We're definitely not looking for a huge packet of information, but we just want to see really thoughtful responses so we can get a sense of what you're planning, and then we can ask appropriate questions and offer feedback as necessary. And so whenever you have developed your proposal and you feel good about submitting it, you can send it over to Amelia and I. Definitely needs to be before Friday, September 15th at midnight. And our emails are listed, and you also have our emails from some of the communications as well. So this is another section as we're talking about the application specifically that is in your RFI docs, but this is just talking about how the proposal is broken out into different sections and how those sections are weighted. So you can get full information about this criteria on page 12 of the RFI doc, but you can kind of see here exactly how it's weighted. It's out of 100 points. we are DEEL did put a lot of thought into exactly how these different sections were going to be weighted. We think all of these sections are really important and critical, which is why they have points attached to them. We're really excited to see how, see what your school puts in the application. But obviously we value all these different sections. There is a big emphasis on readiness and just making sure that your school is able to utilize this funding right away, because we just want to make sure that there is existing, whether it's existing structures or existing partnerships or existing capacity to make sure that this funding can be used right away. And we heard very clear from the pilot schools last year, including you, Principal Lamb. You gave actually really great specific feedback, if I remember correctly, about just how important, just how valuable this funding can be if it's available at the towards the beginning of the year. So and that schools are ready to convert on it. So we're excited to see the responses around readiness and everything. There is a section for budget. That is the budget template where you're actually going to go through and let us know what each of your sort of proposal ideas will, what you estimate them to cost. And even though that's not going to be scored like the other sections, it is mandatory for your application to be reviewed. So just a note there. We can go to the next slide. So obviously this was a big overview. We spent a lot of time sort of giving you the background about this funding and how this funding opportunity was forged, and with different levels of stakeholder engagement. And we talked a little bit also about the application, but there's probably a lot of questions. Your school will need to go back after this info session and sort of huddle and kind of take stock of what your initial strategy could be and what sort of resources are available, what potential interventions and supports you might want to go find and work backwards from if you don't have like a identified community provider or a specific support for a root cause that you might have identified. So we know that your proposal will take some time, and then also capacity is, as you're getting ready for school, capacity can be kind of stop and go. So what we want, Amelia and I definitely want to offer our support during this proposal development period. So one of our asks for you and for all schools that are invited to apply is to schedule a one-on-one consultant session over the next few weeks of this open proposal period between us and your team to support proposal development. So again, just to think about, I know you're all school leaders and you're thinking the calendar is really clear in your mind. It's definitely over the next like 6 or 8 weeks with the return to school. But just to sort of outline this, Wednesday, August 16th, that's today. This is today's info session. We are available for one-on-ones basically starting tomorrow through the day before the applications are due, and which is September 15th. And then award notifications, when we actually reach out to schools, that is going to be Friday, October 20th. So that's sort of what the next 2 months or so look like. But what we really encourage you to do is to, after this info session, huddle, take stock of what's available, what you're thinking, and then once you have some ideas, and we would love to answer any questions. Get on calls, get on a one-on-one consultant session to talk you through, hear a little bit about your idea. If you have any questions, we won't be able to provide scoring feedback or anything like that, but we just want to be able to provide technical assistance as you're developing this proposal, if that could be of help for you to sort of evaluate exactly what you're going to include in the actual final proposal. And so that's our ask for you. We'll also follow up with you to sort of proactively invite you to schedule that one-on-one. But just want to make sure that we do it at a time where you all have capacity, and then B, you've had some time to take some initial passes at what your proposal might entail. And we can move to the next slide.
I think that's actually it. Those are all of our slides.
Great. So yeah, that was our overview of the investment history, the vision for the switch from the pilot to the network, and sort of a very brief overview of what the application process will look like. And we have some time now for any discussion, any questions. And obviously we have a sort of a smaller group, so we're happy to be on the call and answer any questions.
Thank you. What have a couple that I'm wondering a little bit about. As you might recall, we some of our investment last year was focused on adult learning, professional development. I'm wondering, I just trying to think about the parts, that are scored and everything. Is the hope that we will de-emphasize adult learning, or is that more something that's just kind of embedded in how we support, I guess, the protective factors piece?
Yeah, I would say exactly the latter. So we definitely encourage adult learning. Again, heard that loud and clear from students that they need their teachers to be supported in order to be able to support them. And so it would just be up to you to draw that connection for how that specific PD is then connecting to increasing protective factors, creating more trusted adults in the building. What is the benefit to student mental health? But